And as researchers around the globe race to find a vaccine for COVID-19, there's been an incredible amount of attention paid to antibodies. Now it appears many people who caught the virus are losing those antibodies a lot quicker than doctors originally realized. Chris Conti takes a closer look at what this could mean in the fight against coronavirus.
Hi everyone, this is day 8 of my Corona journal.
This was by no means the way Diana Barrett envisioned spending the first few days of March, isolated at home, sick with the virus.
I woke up with 103 fever, a respiratory infection. I felt like I had an elephant sitting on my chest.
Diana was one of the first people in New York to catch COVID. To this day, she's still living with residual symptoms, some 6 months later.
COVID is supposed to go away like the flu after 2 weeks, but COVID is nothing like the flu.
In an effort to help find treatments and develop a vaccine, this 46-year-old has been donating plasma as often as she can. It's in her antibodies where the key to fighting this virus might lie.
Understanding how the immune system responds to the virus will help kind of development of the vaccines.
That is Dr. Wesley Self. He's a researcher at Vanderbilt University Medical Center. He spent the last few months trying to figure out what antibodies are telling us about COVID and how to fight it.
We need to be going after things that will make people better.
Dr. Self and his colleagues spent the last few months studying 3,000 people, all of them healthcare workers, and all of them tested positive for COVID. They found that people who had the most severe cases of COVID started out with the most antibodies. But the study also found after 60 days, almost everybody who had coronavirus lost those antibodies. That could be bad news when it comes to our body's ability to fight off the virus for a second time.
These circulating antibody levels is one piece of the immune system. If the virus kind of represents to somebody who's had a decline in their antibodies, it's very possible that they will kind of ramp up again quickly and prevent reinfection.
All of this also means researchers now need to get blood samples from people fairly quickly after they're infected before antibodies disappear.
We need to be really thoughtful about vaccines and treatments that are specific for this virus.
Many young, healthy people with no pre-existing conditions suffering on month 5 of COVID, month 6.
Finding a treatment or cure proving to be just as complex as the virus itself. Chris Conti, News Channel 5.